Sometimes the school sends a kid home, he thinks the kid has ringworm. First of all, is ringworm very, very contagious?
Ringworm's contagious, but the question is what they mean by ringworm. So if you're talking on the body or you're talking the scalp, you have two different entities. Ringworm, kids don't get it in the groin much, so that's not a common location for a kid. The most common group for ringworm would actually be high school wrestlers.
But if you do see ringworm, does that mean the kid can't go to school?
No. As soon as you start treating the kid with a topical antifungal, you probably killed off 50% of the fungus in the first 24 hours.
So how soon can they go back to school?
I'd send them back in one day.
So you see them, you treat them, they could probably go to school the next day?
Yeah, because it's like a strep throat. In other words, once you put the kid on antibiotics, within 24 hours you killed off enough of the strep that the kid's not going to be able to infect somebody else.
If it persists, do you ever have to put them on systemic?
Yes.
When would you decide to do that?
Scalp always.
Okay, we understand, but say in the body, would you ever do that?
Extensive, too big an area, can't get enough cream in terms of the plan because it's going to take too much. You know, I'm limited to how much a third-party payer will give, you know, X number to. The other problem you have with ringworm, and you don't have it with bacteria, there's no sensitivity studies. It takes 4 weeks for fungus to grow. So there cannot be a sensitivity play for fungus. So it's always a statistical game of which topical is going to work. So I have a very easy rule of thumb. Anything that's been around longer probably has a higher resistance rate. Newer antifungals that haven't been around as long probably are less resistant. So if I have an option to write a brand, I would. If I can't write a brand, I'll go with the generic, but a brand will probably work where the older generics won't. And we're talking the difference between 99%.
So the basic rule, if it's around a long time, the bugs have been hit with it, they know how to get around it. Is that
yeah,
correct?
because it's been around a long time.
And if you see it, that type of ringworm in the scalp capitis, that's very tough to get rid of. And that, you have to use systemic?
You have to use systemic because once it's in the shaft, you get rid of what it's
and
there.
And what would you use as your drug of choice?
Lamisil if I could.
And if you couldn't?
I'm stuck with Griseofulvin.
And how long would you have to treat the person?
Griseofulvin 2 months. Lamisil is, Griseo's 3 times a day for 2 months. Lamisil is 1 dose a day for 4 weeks. Problem is, the company's never going to bring it out for pediatric use. There's not enough money in it.
So in other words, you could use it, but you have to tell the parents
it's off-label.
It's off-label.
And the problem is it's a pill.
But an older kid isn't a big deal.
Yeah, it's not a big deal. So it's far better. The data is better. It's like 4 weeks instead of 8 weeks, and it's a far safer drug.
And if for someone...
Griseofulvin was really bad rashes.
Okay, but if you got it in the scalp, and if you don't treat correctly, you can have a hair loss from it, can you?
Well, you're going to get hair loss, and then if you get a secondary infection, you can scar the scalp. And the kid's not going to school with ringworm in the scalp. They're not going to let him in.
Okay, if you have it in the scalp, how long will it be in treatment before you go back to school?
I bend the rules, so I'll let a kid go. I start the kid on a Thursday, I let him go back on a Monday or Tuesday. I'll try and get 4 days.
So about like a 4 or 5 day window?
Yeah, I mean, like theoretically, they want him clear. So
it won't happen so quick.
It's not going to happen so quick. So if I get upwards of a week of drug in him, I'll probably have the external scalp clear, right, although the shaft is still infected. And I need that next 7 weeks to get the shaft clear.
That particular one is very, very contagious.
That's very contagious, and then you have to throw away all the combs, and you got to throw away all the hats, or the hats got to go in a hot water wash.
So in other words,
you essentially got to sterilize the environment.
It's not an easy thing to handle.
It's easy to handle. The issue becomes it has to be treated adequately. So it has to, if you go with Griseo, it's 2 months.
Okay, but these medicines, most of the time, you're successful with. Is that correct?
Yeah, it works practically always.